Well, good Sunday evening, YouTube. It is Sunday the 30th of October because tomorrow's Halloween. Good news, today I voted. In fact, my son voted for the very first time today. So that's really, really cool. Probably not the best election for him to have as his first election, but, life is what it is, right? So, I wanted to take a minute today and sort of re-vlog my last two vlogs for a couple of reasons. First off, I vlogged about two things that I think are really important to those of us going through mastectomy and reconstruction. But they're sort of complex topics, and I vlogged about them when I was feeling really emotional about it. So, for those of you just tuning in, my last two vlogs were about cording, C-O-R-D, cording, and about grams versus cc's. Now, in between there, I was also giving updates, right? This is what I look like today. Here's what my doctor's appointment was like, and so on. But I really felt like I didn't do either of those things justice. So I wanted to come back and have a vlog just about each of those two things. Really talk a little bit more about them because I've done some more research. You know what happens? You figure something out, you get really emotional about it, you get really pissed off, and then you decide, you know what I need to do? I need to go to the Googles, of course, because all the best answers on Google, and so are all the worst answers, by the way. So I went and I did some research on cording. And so one of the first things, I think I brought it up last time, was cording's actual medical term is Axillary Web Syndrome. And so what it is when I raise my arm up really straight, you can see some cords. You might not be able to see them. It's right here. There's like an actual cut coming into my arm right here. It's really tight, and then really in my forearm right there. And the one in my armpit is almost gone now. I don't know if you guys can see it. But the straighter I make my arm, the harder that cord comes out. So it's definitely all the way up to my wrist right here. It actually extends to right there, and it's painful. So what this is it normally starts from the scar in your armpit. It is a side effect of having either sentinel lymph node dissection, which I did have, or some people actually get like all types of lymph nodes taken from there. It's actually more common in people who get multiple lymph nodes taken from here than from someone who just has a sentinel lymph node taken like I did. But as you can see, it can happen to those of us who get a sentinel lymph node taken too. So it originates in the armpit from our scar tissue, and then works its way up the arm. Strangely enough, nobody really knows why it happens. There are some theories that say that it's from the actual scar tissue has stressed out the lymph system so badly that the actual lymph tubes become hardened. They get hardened as like sort of a form of scar tissue. And then that hardening works its way gradually more and more and more up the arm. So treatment-wise, one of the things I don't think I said that I really feel like after having done the research that I should say is that this is not a thing that resolves by itself. Talking to your doctor about it is actually really, really important. And I actually have done that. And I think I mentioned I'm going to try and go and have go to physical therapy and have that sort of massaged out. So that brings me to treatment. There are some treatment techniques that can be recommended. The first one that was recommended to me was Naproxen Sodium, and I mentioned that I'm taking it daily. But I did not know that's not like a long-term solution. It should be seen as temporary until the stretching and the manual therapy work out. So then you do the second thing, which is stretching. There are some stretching exercises that really have to do with like forcing yourself past the pain to straighten your arm. Your doctor will teach you the right things that you should do. The good thing about the stretching exercises is once you get to the doctor and they tell you what to do, then you can do those exercises at home. And so I mentioned painkillers and then stretching. And then the third thing is called manual therapy, and that is where you go into physical therapy, and I am hoping to make an appointment here tomorrow or the next day to see someone that is a physical therapist that deals with breast reconstruction rehabilitation, specifically to sort of work this cording, and I guess they pull on it and sort of stretch it, and there may be some popping, and it might actually snap or break. That tissue that has hardened is probably not useful to your body anymore anyway. The good news is that even if it pops or snaps, it not only won't hurt, but supposedly, according to the Googles, and actually let me be more clear. I went to breastcancer.org, so I believe that's true, that it won't hurt. I don't have fear about going and getting manual therapy because I think it will actually be helpful and it won't be painful even if there's some snapping and weird popping sounds and whatnot. Because what will happen is once that snaps or pops, then I'll actually be able to raise my arm above my head again and I can stop taking painkillers. And then there's another thing that they can do, which is moist heat. And I have been using heating pad myself. Tremendous relief. I love it. I absolutely love it. So I highly recommend it. But supposedly in therapy, they can put some moist heat on there. Again, this is sort of a doctor thing, so do what your doctor tells you to do. Because I guess if you have a lot of lymph nodes taken, if you put too much moist heat on there, it can push the lymph nodes to push more fluid and you can get lymphedema from that. So don't take my advice, take your doctor's advice, but that is a therapy that they may use, moist heat. That may be a technique that they use with you. And then the last thing that they might do is small laser treatments directly on the skin that somehow break down the hardened scar tissue. So the things that they could do for cording then are pain pills, which you'll take on your own, stretching, which once you learn the stretches you can do on your own, and then manual therapy at a doctor's office, which might also include some moist heat, and then lastly, potentially for less patients, but they do sometimes do low-level laser therapy on the skin surface to actually break up the scar tissue. So I feel like that's a much better way of covering cording than my initial sort of, what the hell is going on with my arm? Let me tell you all about some stuff I'm going through. So that was the first thing I wanted to cover. And I've decided not to cover the second topic tonight. I will do it as a separate vlog just so that we don't get out into 25 minutes, 30 minutes of a video and it's just too long. And I think my son gives me the quick TLDR if I send him a long text, right? So too long, didn't read. I think that applies to vlogs too. So for now, I'll just say thank you so much for tuning in. I absolutely cannot express how much it means to me. These vlogs were cathartic from the start. But to be able to develop a sense of community and to get feedback and to have comments and to see people subscribing, that's really, it's touching. So thank you so much. I can't express how much that helps as we walk through such a difficult time. So no matter what your reason was for subscribing, or if you haven't yet subscribed, subscribe. And just stay tuned that I will continue to walk through this process jointly with you. I think it's worth it, and I certainly know that for me, it's helpful to have a conversation with people that actually I can relate to, that are going through a similar struggle, or that have a family member that is going through something similar. It's amazing to share it, so I appreciate that. And we'll see you again sometime later this week, where I will talk about grams versus cc's and breast size and cup size, and why did I make such a big fuss about that at my last doctor's appointment. So look forward to that. That should happen later this week. See you soon.